Hi everyone, my name is Matthew Rosin. I'm a senior at West Texas A&M and I'm here to give you my management leadership presentation. So what is the purpose of a public administrator? The main objectives for a public administrator is to serve the community by following legislation that has been enacted by bureaucrats. How they do this is by providing a strategic plan. A strategic plan is also known as a deliberative, disciplined approach to helping key decision makers in organizations figure out what they think they should be doing, how, and why, according to Hughes. So, how they do this is by focusing on outcomes for the general public, the overall organization's mission, and how or to satisfy key stakeholders. Um, the goal is to create outcomes that are efficient and effective. So my presentation has to do with the coronavirus or the COVID-19 pandemic that we're going through right now. So the COVID-19 is an infectious disease which is spread primarily through respiratory droplets or small particles, usually spread when individuals cough or sneeze. They can be spread through the air or on surfaces. Symptoms of COVID-19 include respiratory illness, fever, shortness of breath, muscle aches, diarrhea, fatigue, many other symptoms, and they vary on the severity from person to person. This can result in hospitalizations or even death if the symptoms are severe enough. The coronavirus was declared a global emergency by the World Health Organization on January 30th of 2020. So what was the response of the city of Lubbock, that's where I reside, to the COVID-19 pandemic? The city of Lubbock used co-production from both the public and from government officials. The organizations involved with developing protocols to combat the COVID-19 pandemic included the City of Lubbock Health Department, the City of Lubbock Emergency Management Department, the Mayor's Office, the Governor's Office, the Centers for Disease Control and Prevention, also known as the CDC, the Texas Department of State Health Services, among other health partners. So the response continued. What was the city's overall goal and purpose? Minimize loss of life was the number one goal. They know with the pandemic that if it got severe enough, we would be losing some individuals. They wanted to ensure the safety of the public and to continue to provide efficient and effective measures. Along with all this, they had to continue to make daily city management decisions. That includes budgeting, allocating resources, among other things. Executive Order GA 32. This was enacted by Texas Governor Greg Abbott to combat the COVID-19 pandemic. It provided the framework for the City of Lubbock's response. Initially, what it said is it's going to limit the outdoor gatherings of 10 or more people. They use this to assist with the social distancing and to limit the spread. Executive Order GA-32 also limited restaurants, retail stores, office buildings, manufacturers, gyms, museums, and libraries to 50% capacity. This was the initial order. This has been changed, but we've kind of gone back to this since June. It also initially said any county with more than 20 positive cases that face masks would be required. If you did not follow this, you could face a $250 fine. So what was the rationale for these mandates? They continue to evolve and develop with the situation. As we all know, COVID is continually changing things day to day. So These city officials had to rely on data from the health department and the CDC, among other health professions. They wanted to ensure the safety of all the community members, including the high risk, people with comorbidities, elderly, and minorities. Safety was the number one priority. The economy was second. They wanted to protect their citizens first and then worry about the financial aspects. So all that, so consider all of these, safety measures that they're taking on. They also really wanted to make the economy important. They must make those daily city management decisions to ensure that the economy continues to prosper. So what was the public opinion of the response by the city of Lubbock? Um, Initially, it was resistant to the mandates put in place by the city and state officials. This was a quote from a New York Times article. It says, "Trust in government is gone if it was there to begin with." That's from Goodman. What that means is that, or what's that showing is that the attitude in not only Lubbock but in West Texas in general is conservative in nature. So community members refuse to abide by regulations that are enacted. Most people in West Texas, don't want a lot of government interventions in their everyday lives. So pushback continues. So the city officials are tasked with keeping public safe and to satisfy the key stakeholders, which in this case is the general public. So how did the city, make their decisions? Um, Johns Hopkins University put out a article, kind of like a guideline, called "Management Metrics for Cities in the COVID-19 Crisis." What the city officials can use this for is the enforcement of public health measures, along with the everyday city management decisions, including a guide to how to manage the city, communication with the community members, how to advocate for at-risk populations and minorities, and how to allocate certain resources. City management also used the Center for Disease Control and Prevention. They offered key resources for these city officials, including prevention and control studies, laboratory capacity, community mitigation, surveillance and data analytics, contact tracing, and staffing. The CDC provided this information and to assist with, the overwhelmed health department and Department of Emergency in the city. So the CDC also offered suggested parameters for opening up community events, detention facilities, community centers, skilled nursing facilities. It just kind of provided a framework for the overall reopening of these facilities. So what is my policy regarding the COVID-19 pandemic? My approach would be very similar to the policy already enacted by the city of the city of Lubbock. However, I would take a more regime theory approach. Now, the regime theory, according to Morgan, Engel, and Shin, highlights the limits to the transferability of principles and governance principles and leadership practices from one contextual setting to another. What this means is they want a reduction in the size of government, contracting out services, decentralization of government, and to become more customer oriented or customer service oriented, and that includes becoming more open to the public and willing to engage with the public. The contracting out of services, we're talking about testing sites, laboratories, enforcement officials, including health departments, police officers, pretty much anything that has to do with testing or enforcing testing for coronavirus and enforcing the protocols enacted by the city. What I mean by the decentralization of government is I wanted them to rely more on the city officials than state official mandates or even federal government mandates. We'll go into that further. So what do I mean by the decentralization of government? I believe that the federal government should let the states decide the best course of action. The states should let the individual counties decide, and then the county should let the cities decide on the best course of action for their individual cities. I believe that these decisions should be community oriented and not just federal or state mandates. I think individual cities should take the suggestions from the counties and the states and the federal mandates and kind of warp them into their own um, individual processes and protocols to better serve the community that they're involved in. How are we going to do this? The use of co-production. So co-production is a relationship between government officials and the public. It increases the policy adherence, I believe, from the public if the public has a say in what the government is going to allow them to do. I think that they'd be more likely to follow those protocols. And this could lead to a decreased spread and decreased number of positive cases within their community. So what I suggested is the city officials open up an open forum for public opinion. This will allow the public to share their ideas, their thoughts, and their frustrations with the protocols that the city officials have provided. I think the agenda should include a suggested course of action by city officials. This will provide the framework, very similar to the protocols that they have already enacted. Right now, they should be open to suggestions and changes from the public. And then at the end, I think they should be voted on by the public and the city officials involved from the various departments, including, health department, emergency management department, mayor, um, anybody involved in the decision making. So what should the course of action include? This should include the requirements for face coverings when in public places, the maximum occupancy allowance. This should be at any public place. Hospital mandates, allocation of resources and funds associated with the COVID-19 pandemic, and then how do we prevent future outbreaks and curb the curve at this point. So what are some of the barriers to my policy? I'm really concerned about the pushback from the federal, state, and county government officials to the decentralization theory. I think that once you give somebody power, it's tough to get it back. So I think we might get some pushback from them. Concerned about public attendance to the open forum. My suggestion would be not to do the open forum live. You could do it a Zoom call or something similar to that. Increased time required for the voting process. Time is important right now. Things change daily, so I think that if we voted on this, it would have to be soon after the open forum. And then there's also the increased costs associated with decentralization, including the testing facilities, laboratories, the enforcement officials, along with surveillance and data analytics. And then you always worry about continued adherence to the policies that are enacted. Is the public going to continue to push back and kind of do what they want, or are they going to step up and do what the city officials come down and say is the correct thing to do? So here are my questions for you guys. In your opinion, is the regime theory approach the best choice when tasked when implementing a city plan to combat the COVID-19 pandemic? And what are the benefits and barriers to your suggested approach? And then how can city officials and the public benefit from co-production during the COVID-19 pandemic? What are the other ways that co-production between these two entities would create a positive outcome? And here is a list of my references that are used for this research paper and this presentation. Alrighty, thank you guys so much and good luck.